If you have a cut or an injury in your skin, a scar will form and that will heal over, and that will get fixed and cured. If that happens in the spinal cord, the scar remains there and nothing can grow through it. So no new nerve fibres can grow through this thick, but it's like a block to repair. So what we try and do is break down this scar tissue and make the tissue more growth, what we call growth permissive. So it allows things to grow through this kind of wall or this barrier to repair. So at the moment we've had some really exciting breakthrough using our gene therapy approach, which breaks down scar tissue in the spinal cord. And you can see here that normally after an injury you get these huge holes in the spinal cord, and in red here you can see this thick scar. What we found with our gene therapy is that you can repair much of this damage, and this has shown some really exciting effects in our animal models. We've got regain of hand function and some regain of limb function, and there's also been some regain of bladder function. All these are very, very important for spinal injury patients and really important goals in our research. Because these results have been so effective, we've never seen anything work like this, as well as this, in the spinal cord. The next stage is to try and translate this now forward to the clinic, which means we need to try and do some safety and efficacy studies and eventually move forward to clinical trials. So I think it's a really exciting time for spinal research, and therapies such as the one we're working on and other therapies being worked on in other labs around the world are now coming to the stage that they really are being pushed forward to the clinic, and we maybe even combine some of these therapies together to get an ideal therapy for spinal injury patients. And I really think within the next 5 or 10 years we're going to get these therapies to the clinics, and patients are going to get some function back of their hands and of their legs.